In fact, 18 years ago, when I began my career in the Indian Administrative Service, I was fortunate to see the power of this community-driven development model in the state of Andhra Pradesh, from where I have come from. Thanks to the South Asian Poverty Alleviation Program, I think Shoaib Sahab has already mentioned about it, but that program has actually been seeded an idea. It's a great idea in India. I see that the program has seeded an idea, a model for effective poverty reduction, and later on that was replicated, as Shoaib Sahab, in the entire state of Andhra Pradesh. It's a southern Indian state which used to be called as southern Bihar. Bihar is one of those underdeveloped states in India, and Andhra Pradesh used to be called as southern Bihar. So that place has changed significantly over the last 15 to 20 years. You can see as the numbers itself speaks about over 11 million women have been organized under that program. And this program, by seeing the success of the program, in 2007, this was in fact the Rajiv Gandhi Charitable Trust wanted to replicate this particular model in the state of Uttar Pradesh. Many of you may be knowing, Uttar Pradesh is the most populous state in India, which holds 9% of the global poor. In fact, it has certain human indicators, development indicators, which are worse than the sub-Saharan countries. One of the why the trust actually, the trust, when it initiated, one of the things the trust had seen the power of the model that has been implemented in Andhra Pradesh was that this model provides a bridge between the government and the poor. In fact, this is something that is that was missing. One of the fundamental problems, in fact, the famous quote of our former Prime Minister Rajiv Gandhi was that you send 1 rupee to the poor, only 15 paisa reaches. So there's a lot of the leakages in the system, and the leakages are for various reasons. In fact, people see very simple I think method, but there are different barriers. The barriers includes social barriers, the barriers include feudal and hierarchical barriers, the barriers include psychological barriers. So the trust actually, when it felt that this is the model actually which is needed to connect the poor with the supply side. So the work started in 2007, and simultaneously in the state of Bihar, it was again funded by the World Bank. A program has been started. So that way, this entire model now is actually being replicated, in both the states, in UP and also in Bihar. And the UP program, in fact, I have led the program for 7 years, from 2007 to 2014, and this and Shoaib Sahab was the advisor to the program, and the program, which started with 100,000 members in the first year, and now it has grown to 1.5 million women and spread across 42 districts of UP. And actually, in fact, the idea is that we would like to saturate the way actually in Andhra Pradesh, it was actually reached a saturation stage where reaching out to every poor household. So one of the things actually, some of the learnings that actually I would like to share, which would maybe benefit all of us to have a discussion, reflection, and also a debate, is that in fact the model actually, as I said, we have actually followed a self-help group based model. We have the self-help groups at a in fact grassroots level, which are organized at a village level as a village organization, and at a administrative unit level as a block organization. And what we found is that the self-help group platforms not only provide a pipeline to deliver various developmental interventions. In fact, they are addressing the root cause of the problem. In the sense, like, what is the root cause of the problem is essentially what we started looking at. The root cause of the problem is the very idea of hierarchy that exists in the society. So unless you disrupt the idea of hierarchy, many things cannot actually flow. So whether it's information or whether it's the resources, it's very difficult. So what we found is that by organizing the women who are the most marginalized in the society, who have so many barriers, and then through them actually we could able to disrupt the hierarchy within the family, bringing that equality, decision making within the families. And by organizing them at the village level and the block level, we could able to connect them horizontally across different communities, which are again, in fact, you're aware, the society is divided into different, communities, castes, and so basically bringing a platform actually and helping the people to realize the power of the multiple perspectives and power of each one, valuing each one's value within the society. That way, we could able to actually what we have been seeing is that actually this model is addressing that problem. It is actually disrupting the idea of hierarchy that exists in the society. And the other thing, as I said, like I've already mentioned about it, this is actually to reach out to the last mile population. I think we believe that like there is no better way we can reach out to the last mile population other than organizing the poor. Without organizing the poor, like as Shoaib Saab said, like you can actually go for cash transfers and other things, but unless actually an organization of the poor exists, in fact, those interventions, those developmental interventions cannot reach the last mile population. In fact, I would like to tell you that like we have in UP, what we have done was we have expanded and modified the scope of the model by not only using it for economic empowerment, but also actually using it like an operating system to develop various other interventions like health, education, and other things. And this actually is again, it has been appreciated very well by the Gates Foundation. And in fact, today, this program, these women's groups are actually saving newborns and mothers in the state of UP. There are so many, in fact, not only the deaths occur not only because of lack of delivery of services, more so because of certain behaviors, certain taboos. In fact, the mother's milk as a taboo, mother's first milk is not given to the child, which is actually like a first immunization for the child. So these are the in fact when we started actually organizing the poor on these social issues, we found there's a tremendous impact on health indicators and education indicators. So the other thing I have already mentioned, but like I would like to reiterate, actually we often in the government we try to fix the problems through the supply side, getting more programs, or in fact suppose health is a problem, set up a primary health center, or set up a health worker. But the problem is that in fact often actually the problem is demand side problem. So to fix the demand side problem, we definitely require an institutional models like this. And the other thing, important insight what we have seen is that to impact at scale, in fact the problem is so huge. As I said, the state where I have worked has got 9% of the global poor. So to impact at scale, we don't have any other model other than the community institutional model. you have to engage communities like in fact what Fauzia Behan was doing. So we need to engage them, we need to give leadership to them. It's very difficult to get development professionals to work in these areas. Very difficult, in fact. And another thing is that definitely the governments have to invest in this institutional model. And finally, this is again, as I said, like this is actually a movement which is helping to strengthen the democracy. Today, we have been seeing even in the Andhra Pradesh as well as in the Uttar Pradesh where we work, large number of women are participating in the local body elections. In fact, and when they actually represent the local body elections, the way they take care of certain issues are completely different. And there are studies to show that, like, even the crime reporting has increased wherever the women pradhans are there. Finally, I would like to conclude. I think the one thing I would like to make, one point where I think you can discuss. But many times when the people in the development sector ask for the exit strategy, I think this is one. I think we should actually, when we talk about it, requires at least one generational support. It's not like a program where you work in 5 years. I think you can actually fix the problem. It requires a generational support. That requires a sensitive support organizations, a committed support organization is needed. I think that's the role here NRSPN and RSPNs are doing here. In India, it is it's a SERP, RGMVP, and different organizations are doing this work. I think I would really thank the organizers for inviting me, and I'd look forward to hearing from you more. And we have circulated this a small note, in fact, describing the insights given by Shoaib Saab. I think it will be very interesting to read. Thank you very much.